prostate cancer really, detection really depends on how you look, when you look, where you look, and how hard you look. As you can see here in this interesting statistic, that the autopsy rate for defining or finding prostate cancer is about 50% for the men over the age of 50. So that means that no matter what the cause of death is, that if when they do an autopsy at the end, that 50% of the time they're actually going to find prostate cancer. The number that's more significant to me is the clinical prostate cancer. That's the prostate cancer that we actually find, usually the cancer that actually needs to be treated or not. So that gives us an idea of where we are. So if you would just want to break it down, essentially 20% of men over the age of 50 will be affected by prostate cancer. The death from prostate cancer is 2 to 3%. So it's rather low, but for men who it's going to affect, there is a significant death rate. And we'll talk about those particular group of men here in a few minutes. So the rate of detection, this was a study done in Detroit, showing that obviously that most people know this in the room, that prostate cancer is not really a disease of youth. It's more a disease of aging. And the rates really start to go up once you hit above 50 years of age. There are risk factors, and those include age and race. African Americans certainly have a significantly higher risk of prostate cancer, and I think this slide also includes the age as well. And again, this just reiterates the fact that men over 50 are really our likely patients who are going to be affected by prostate cancer. Family history is a very important risk factor. So if you are a member of a family who has a history in your family, so your brother or your father, those are the most significant relationships. You can see through this small chart here that with family history, the age is earlier and the detection is also much higher in men. So it is a trait that's passed down through the bloodline. This just, again, reiterates the risk of men getting prostate cancer if they do have a family relative. And you can see the earlier the age of onset is correlated with the risk factor, including father or brother and such. So, what is the risk of clinical prostate cancer? And that's really the group of patients we want to talk about tonight. The risk is really substantially driven by the frequency of biopsies. So the only way that we detect prostate cancer truly is through a prostate biopsy. Now, we have screening tests, we have blood tests, there are some imaging tests, there's a rectal exam, but all of those really lead to the definitive diagnosis being made by doing a prostate biopsy. And that's usually done in the clinic or sometimes in the outpatient surgery setting. Over the last 20 to 25 years is when PSA screening began. PSA screening, again, the simple blood test, and we've really seen a change in the dynamics of the disease since we began screening for prostate cancer, and we'll see some graphs here shortly that represents that. So here, you can see, if you look at this chart here, around 1985 or so, a little before, is when PSA screening really began to be done, and you can see the rate of increase went really high initially, and that's because we started finding cancer we weren't really looking for. And then the levels had then dropped off since that time. So where we've essentially have screened enough people where we're finding it early enough and the rates aren't increasing. Prostate cancer represents 25% of all cancers diagnosed in men. So looking at this, it is the most commonly diagnosed cancer, excluding skin cancer. The prostate cancer is higher than lung cancer, colon, bladder cancer, and etc. In 2009, 192,000 people were diagnosed with prostate cancer. Now that number is actually more like 220,000 men are being diagnosed in 2011. The rate of death, so again here, this shows that in 2009, 27,000 men in the United States died of prostate cancer. That's actually gone up now. It's really closer to around 32,000 men are dying each year of prostate cancer. So those who say that prostate cancer doesn't have a significant mortality, well, it actually does. And when you compare it to the other cancers, it's the number 2 cause of death in men regarding cancer. This just shows that the death rates are declining, and this again correlates to the time when we started screening for prostate cancer. So Treated prostate cancer has a lot lower risk of dying than untreated prostate cancer. And certainly the earlier we find prostate cancer, the more aggressive we're able to treat it if it needs treatment, and the more lives that we're able to save because of that. Now, epidemiology, just in conclusion. So, to review, it's the second leading cause of cancer death in men. The vast majority of men who are diagnosed with prostate cancer won't actually die of cancer, although it is the number 2 leading cause of death related to cancer. And PSA-driven biopsies has increased the detection rate and possibly decreased the death rate among men.